we're going to learn how to hand instruments, and we're going to learn how to hand different things to a surgeon that would be across from you that was left-handed or right-handed. And it wouldn't have to be a surgeon. It could be an assistant. It could be anybody. But somebody across from you that's left or right-handed, and somebody that's next to you that's left or right-handed. And so besides that, we're going to learn how to put on and off, take off our blades and put our blades on our knife handle. Do you think that we should turn the lights on? Will it be too bright?
No, no, I think that
turn
would.
both those switches a couple. No, up above. There. Yeah. Give me two. Go to the right. There. And do the other one if you will. Maybe that'll work better. Okay. So the first thing we're going to do is to learn how to put a blade on. Now you know the blades are going to come in the foil packages in your custom pack, or your RN may open one for you to take. You may even find the blades lying loose on your field, which is sort of dangerous. Hopefully not, and if they are, they tell you where they are. I believe that you should always put the blades on using a needle holder or a Kelly. And so today I'm just going to use a needle holder. This is a 15 blade, so we know that the 15 blade has to go on the number 3 or the number 7 knife handle. And so you want to grab the blade from here. Never go across the blade's edge or you will dull it. So grab it from here, and I clamp the instrument. Then I take my hand out and I put it on the instrument, the needle holder. And if you look, you will see an angle on this blade, and there's an angle on the knife handle. So this cannot go on it this way. It has to go on it this way. And then what you're going to do is, holding it over a sterile surface, you're going to slide this in and you'll hear it click. Now when you take this off, you also want to use an instrument like a Kelly or a needle holder, and always take it off holding it above your surface, because it's a natural tendency to do this. Now you don't want to be so close that you poke the blade through your towel and through your mail stand, because it will have contaminated it. Don't do it over the patient. Don't do it up in the air. Do it over a surface like your back table or your mail stand. How you're going to remove it is just get a piece of that blade, lift it up here, right here, and get your clamp on it. Now I let go of the clamp. You can keep your fingers in there, but I have a tendency to unratchet it then, so I take my hand out. Now I'm going to go up above my mail stand and do this. You see how you have a tendency to do that? So be real careful. These are razor blades. They're going to cut you. So don't be fooling around in class with this. One time I had a student literally that dropped this and it went right in this hard mannequin's leg and stuck. So these are very dangerous. So once again, to put it on, clamp it here, slide it on your knife handle, and then to take it off, you're going to clamp it down here, hold it up, and take it off like that. Now, these should never lie loose, so you would put those in either the magnetic side of your blade and needle guard box or in the foam. You can see that we've used these quite a bit, so that's why they're like that. Okay, so now we're going to learn how to hand the scalpel. And it doesn't matter whether you're right or left-handed, you're going to have to figure out what works for you. I am right-handed. I like to use my left hand to hand the scalpel. I find it easiest. So we're going to pretend there's a blade on there, and for safety purposes we won't hand it with it on there. I'm going to pick it up where the ridges are on the knife handle, like this. And so I am holding it above the scalpel. You do not want to hold it like this, because if the surgeon grabs it, they will cut your hand. So you hold it above, tell them this is your knife, this is sharp, this is the scalpel, whatever. And just hold both your hands up, if you guys will, sideways. So if I were going to hand this to Nicole's left hand then, I would just hold it out for her and she grabs it. You don't slap it in the hand or slap it like this, just hold it and she will grab it. Make sure they have it, and then she can make her incision. So that's one of your skills, how you're going to hand it. Now, your surgeon will lay it back down. They'll say knife.
Knife.
And then you're going to pick it up. Don't reach for it or you're going to get hurt. You pick it up and put it back. I have seen surgeons put it back on the Mayo stand. Be careful of that. If you got your hands out here, you could get cut. So, let's do it again. Once again, I would pick up the scalpel like this, and let's say that you're right-handed this time. So I'm going to pick it up like this. I'm going to turn it so she could use it. If I were going to hand it to Randy's right hand, I'm going to pick it up, and I'm just going to come over like this. We never hand a scalpel fast, jerky. Okay? Sharp scalpel, I'm going to hand it to this hand. Okay. Now I could have done it with my right hand, but for some reason it seems to make it more awkward. So if I were going to give this to your right hand, you're going to see that this is a problem. I'm going to have to turn it over my Mayo stand so I don't drop it. So I almost have to turn it now to get it so I'm facing the right way. If I didn't do that, I would have to do this. That would be pretty awkward. So that's why I just find the left hand is the easiest. All right. And so your skill is to put the blade on the handle, to take it off the handle, to hand it to a left-handed surgeon opposite you, a right-handed surgeon opposite you, a left-handed surgeon on the same side, and a right-handed surgeon on the same side. So your whole list of skills this week, you have quite a few, and that's why, because that right there is 6 skills. So next we're going to learn to hand the scissors. If the scissors has a curve, like a Mayo or a Metz, you want the curve to go to the surgeon's midline. So if it was Nicole's right hand, the curve would go, I say, to the midline or to her belly button. So I'm going to pick up the instrument like this. I'm going to hold it in my hand, and how I say is kind of like this. I always say like a gun. Can you say that? Okay. And hold it like that. And then I'm going to just kind of slap it in her hand. Not real hard, not loose. I say no teasing, so she has to come and get it. Just give her a little of this. See how this curve is going to her midline? Now, if she happened to be left-handed, I would just turn it in my hand, left. Okay, we're going to pick it up and we're going to give it to Randy's right hand. Boom, left hand. Just like that. So just a little slap. Sometimes they're working and they're not looking and they want to be able to feel it. Suture scissors, you don't have to turn to the midline because there's no curve. So right hand, left hand, right hand, left hand. All right, so that's passing a scissors. Next we'll go to the tissue forceps. And there's a couple schools of thought. Some people are going to tell you that they pick it up from this end. Some people will tell you they pick it up from this end. Doesn't matter to me how you do it. The main thing is that you cannot be competing for where their hand is going to be. So you would normally hold the tissue forceps in the middle, right? So I would not want to hand it to you in the middle because I'm in your way. So I either have to hand it to you from this end or this end. I find this end, it twists. When I go to pick it up, this is just what it does. I don't know, some people don't find that a problem. So whatever works for you. So because of it, you may want to put them on your Mayo stand like that, whatever works. Doesn't matter to me. Now, this would be how I would give it to you in your right hand. I'm going to pick it up like this, and I'm going to go just like this. So I just let it swing like a pendulum. If this were going to be in your left hand, I would pick it up, and all I have to do here, just hold your hand like you would, is lay it in there like that. Okay, so for Randy, I just have to pick it up straight, place it in her hand, and this one I have to kind of turn my hand a little and place it. I could have done it with my left hand, so it works the same way. So that's handing a tissue forceps. If I would have handed it from the bottom, it would be the same thing. This way, this way, this way, this way. So you can decide how you want to do that. Handing a dull retractor, such as an Army, Navy, a Richardson, I just pick it up and angle it so they can grab it. So angle it down. You don't want to have it like that. How would you get it? I mean, that'd be pretty hard. So just angle it down. Now, I'm probably going to want to hand it to her like this. You have to learn to use both hands with this. You'll find that pretty soon you won't even be thinking about it. It would be no different with this instrument. You would hand it down like that. Now, handing something sharp. If you're going to hand, say, the cat paw rake, you want to be like you are on the scalpel, on top of it. Okay, you don't want to be underneath this, because when they grab it, they're going to put that into your hand. So just angle it down and hand it to them like that. Now I couldn't get that to Randy, so I would have, knowing that she wanted it, I would have wanted to pick it up with my left hand and bring it around so that she could get it. Cerebellar, Gelpy, the same thing. Pick it up on the top, not from underneath so you get poked. So pick it up on the top and just angle it down again so they can get their hand in it. And so now we've covered how to load and unload blades, how to hand scalpels, hand scissors, hand tissue forceps, hand a dull retractor, hand a sharp retractor. We'll learn how to hand a clamp. Just grab the clamp underneath, pick it up, hold it, remember the gun thing again, 3 fingers back like this. Curve to the midline, like that, turn it around like that, and like that. Would be no different for a Carmalt. What you want to do is not do redundant things. Don't, and then pass. That'd be kind of crazy. But pick it up and pass it. Okay. Try to keep these so that they're not falling over. So just stick your finger underneath and pick it up. So the point is always sticking out. Your fingers grabbing it like that, and these 3 fingers allow you to give a little wrist action. Turn it around. All right. Next, we're going to load a sponge stick. You're going to take a ring forceps, and there's a couple of ways to do this. One way is folding it in thirds, and they usually like to see the X-ray detectable strip out. So in half and again. Now you want to load this like this, not like that, like that. You're going to hand it no different than you handed a Kelly, like that. Now, this is a short sponge ring forceps. Sometimes they're a little bit longer. And if the surgeon looks like they're down in the abdominal cavity, they're going to just dab the bleeding area. You might want to hand it from up like this, and they'll just dab. Or you could have handed it from down here too, and they'll dab. Once this gets saturated with blood, it's like a paper towel. It'll start seeping up. You can turn this around and use the other end. So I want you to pass it like you would a Kelly, and I want you to pass it the other way. I have seen these folded once again, like this. You may see that too. Physician preference, but this is probably more common, like that. All right. Now we're next going to learn how to pass a Kittner, Peanut, Cherry. These typically go on Carmalts. You're going to take the little Kittner out of there, put it on the instrument like this, not like this, not just hanging by a thread here so it doesn't have any substance to it. This is used for blunt dissection. So you want to put that on there because they're going to separate the tissue layer then. Once again, the old gun thing. So that's loading and passing a Kittner. Remember, we never let these loose on your field. You always want them in the container. There's a peel and stick strip. You could put it on your mail stand. Most people don't stick it down. Most people just lay it loose. So that's handing a Kittner. Next, we're going to learn how to pass a vessel loop on a passer. And this one is much shorter. I think it must have broke off. Vessel loops are like rubber bands that have been cut. They come in different sizes and colors, blue, yellow, red. Some of them they call maxi loop, some they call mini, and it's dependent upon the width. These will be used to identify a vessel, maybe a nerve, and so what they'll do is they will put this on what's called a passer. And a passer could be a mixture or a right angle, and I have seen 3 ways of doing this. Probably the most common is to load this like this. Then follow this, and this is going to be much longer so it doesn't bounce up and touch you, and hand it curved to the midline again, like this, like this, like this, like this. So this is one way of loading it. I've seen this loaded this way, and I have seen it loaded this way. So ask your surg tech which way the doctor likes it. They might not care. This is usually the most common. So if this were, I'm going to hang on to that end. If this were, let's say, our blood vessel that we want to identify, and we don't want to sever it, we might put this vessel loop around like this. Then what we need to do is called tagging. You can tag suture, you can tag vessel loops. So you just put a Kelly, and that would hang like that. That's called tagging. So you're going to do that as one of your skills also. You could have tagged a suture too, like that. So that's passing a vessel loop on a passer. All right. All right, next we will do a clip applier. Now clip appliers come in many different sizes. This is the small length, this is probably the long, and there's a medium length too. And you have to use the corresponding clips that apply to the tip. Now this doesn't fit, but I'm just going to show you. There's 2 ways of loading these. I like to put my thumb over this joint, and you can load it by putting the instrument in the clip this way. Be careful you don't press these, because the clip will fall out. Any tension, the clip depresses and it falls out. So you can load it this way, or you could have loaded it by just holding this on your Mayo stand and loading it. Now there's a couple of ways to hand this. Just like you did a Kelly or a Carmalt or anything, the gun thing. This way, this way, this way, or this way. Sometimes the surgeons may want the instrument vertical like this. So just grab that same area again. I'm still using, instead of being like this now, I'm like this. So you could hand it this way.
Would they grab it right here? Would they grab it?
Usually up higher. This way, or this way. Now, sometimes the surgeons might have their hand like this. So if your hand was like this is a third way. They may want you to come up underneath like this. So let's just say that you handed it to the surgeon this way, and the surgeon sets it down, picks it up, and turns it whatever way. That's your cue that that's the way they liked it. So write that down, remember that for the next time. So the 3 ways could be this way, or flat. The tendency is for the big ones to probably be flat more, where they're, and people will say, well, do they want the tips that are curved a little up or down? I would watch what they're doing and determine by that. And they might have it up one time and down the next. Sometimes it's really hard to determine. Okay, so that now is the clip applier. So you can load it in your hand or load it on the table, this way, or this way. So do all 3. All right, now we're going to learn to pass what's called the Keith needle. And the Keith needle is a straight needle. And this would come swedged on with a stitch in it, or it will come with an eye where you need to thread the stitch. And we won't do that for the purposes of the test. We'll just pass it. I believe you pass it the same way you would pass a knife handle. So grab by the pointed tip down here. Just hold your fingers above. You would grab the stitch this way, and for me to hand it to her, I have to pick it up here here. So you're just holding it sort of over the point. That's passing a Keith needle. All right. Next, we're going to learn how to hand a free tie. And you can hand a free tie, just put your right hand out. So if my surgeon says, give me a tie, I'm going to pull it out from here, put a little tension on, and come up under their hand so they can feel it. If they were tying a vessel, we would hand the suture scissors next to cut this, or maybe they want to tag something. Then it would be the same thing. If they say tag this, put this down on this end. So that's handing a free tie. Now, sometimes we are asked to use needles that have an eye. You can see the eye in this one. And I've got, it's kind of large so you can see it. We're going to load this with a free tie. And there's many different ways of doing this. This is what I think is the easiest. You grab the needle about a third of the way down and just on the needle holder about like that. Not like that, about like that. Some surgeons will even want you to angle the needle. Okay, so we put it in there like that. Now, I've read in books where you load it from the point. I don't believe in that. I think you're going to hurt yourself. So instead of loading it this way, I believe it's best to load it this way. So you load it, bring this down about a third of the way of the stitch. You can see that's probably about a third. And then there's many ways of doing this. I think it's easiest just to stick this back in the tip, hold it like this, it's still the old gun, grab the bottom, you're doing what's called following, and hand that. And the reason you're doing that is just so that this doesn't pull out. So just stick it in the tip, hand it. All right, so that's loading a free needle. Now we're going to pass a swedged on needle. And we're going to pass to a right-handed surgeon and a left-handed surgeon. So this is our swedged on needle. Remember, it doesn't come off. All right, I'm going to load this about a third of the way down on my needle holder. Now I am loading this for a right-handed surgeon. I'm going to tell you what I think is the easiest way. After all these years of teaching, this is sort of what's worked for me. Is I load the needle as if my surgeon is right-handed, as if I'm right-handed. If my surgeon is left-handed, I load it as if I would be left-handed, how I would use it. So we're going to start right-handed. And remember, right means that the point goes to the midline, to the belly button, if you will. So from my right side to the midline. So I would sew like this, right, Randy? It wouldn't be logical to go that way. So it doesn't matter where your surgeon's standing. If they're right-handed, pretend you're right-handed and load this to the point to the midline. Okay? So what I do again is I hold the needle in my left hand because I'm right-handed. You could do it opposite if you're left-handed. Grab it about like this. Now, my right hand's in the finger rings, but to pass it, I have to get my hand back in that like gun position, if you will. So I go back, take my hand out. Here I am, the gun. Grab underneath here, hold the joint, follow the stitch, and now you're going to hand to a right-handed person across from you. All you're going to do is open the door. That's what I call it. Open the door. Instrument is like this, not twisting it at all because you're going to poke yourself. Open the door. Now, come back to neutral. I'm going to hand it to Randy. Same side. All I need to do is come over. You just kind of bend your wrist a little. Don't hold this so close that when you bend the wrist, you put the needle in your hand. Hold it down here underneath the instrument, angle a little and do this. Okay, now we're going to load it as if our surgeon is left-handed. We don't care where they're standing. We're going to pretend we're left-handed. So we turn this around. Remember, the point goes from my left side, because it's left-handed, to my belly button, midline. Load it like that again. Take your hand out. Grab it from underneath here. Follow the stitch. open the door. Come back. If it were Randy, I'm just going to come over here. All I'm doing is coming over here. Okay? So, Randy, load it for a right-handed surgeon. Put this way. And you can't lick it. Wish you could. Okay. Now, are you right-handed?
Yep.
Okay. Grab this here, because you got to put your hand gun. Okay. There you go. Now grab this stitch. Now, open the door. Put it in your hand. That's it. Now this seems a lot easier. Or it maybe looks a lot easier than it is. Believe me, you won't know your right hand from your left, and it will be much harder than you can imagine. So, hand it to my left hand. Put it down a little bit more. Just a little, no, not on this, but this way. Yeah, just a little bit. There you go. Okay. Clamp it. Yeah. Take your hand out. Put it in, gun. Give me the gun. Okay. Now, open the door. You gotta give it to my left hand. I know. I know. It's too bad the gloves don't say left or right. But, okay, now just come back and imagine that the person was just next to you. So you're just doing this,
Okay.
or going this way.
Yeah, you have to think
So-
of which one is their
Yes,
left.
you do. Yeah, you do. It's a lot harder than you think. So, left, right. And this morning somebody said to me, well, are you slapping it in your hand? Well, you still are. I mean, you're not going to be crazy with a needle, but I'm going to put it in your hand, kind of like that. Now with it, you never hand a suture without handing a tissue forceps in their non-dominant hand. Okay, and now what are we going to do with this? We have two options. We're going to cut it, or we would tag it, and we still would have to cut the needle off. So my assistant would probably get the scissors, or if I didn't have an assistant, I would get it. So those are all the skills. We have a couple of different stations set up there for you to practice with, and you can practice your skills from last week too. If you feel like you're ready, you want to test today, we can, but that's kind of...
Did they hand it back